As local news gets. Remember hair plugs, hair transplants that were so visible? Well, our guest now says that's a thing of the past. Dr. Ivan Cohen, a Fairfield-based dermatologist, says he's using some new techniques for hair transplantation that have changed the whole look of it. He teaches this at Yale, and today he's brought proof of that. It works. One of his patients here, Joseph Opedesano, who, by the way, is pretty hung up on hair. He's a hairdresser. He's got his own place. Mr. Joseph's in Westport. Welcome, guys. Thanks so much for being here. I love that you brought a patient. Tell us, first of all, let's get a good look at Mr. Joseph. It's unbelievable, really, because it looks so natural, your full head of hair. And I want to show people, first I want to show, okay, here's a good look at your full head of hair. And now I want to show people the before picture, before you got the hair transplants. That is unbelievable. And I just wanted to start with that because I think in the past people expected to see plugs, and that's what we want to get to here. Dr. Cohen, will you show us on Joseph what you were able to do for him?
Sure. Well, if you take a look at Joe's hairline, you can see that these are single hairs actually transplanted right into the hairline. And that's the difference between the transplants of today, which we call follicular unit transplants, versus the ones of yesterday, which were big plugs.
Could you pull up the front piece there just a little bit? Because I want to show people the hairline looks very natural. And in the past, was there some kind of plastic keeping them in the past?
No, what we did in the past is we used to take, actually remove little circular pieces of skin about the size of a pencil eraser.
Okay.
And
so that would leave a big scar?
That's why it would look like a plug, like a doll's head.
Oh, but it never really was a plug.
Now we take hairs from the back of the head, they're separated under a microscope and planted individually right into the hairline and throughout his head.
Joe, when did you get it done?
First time was 6 years ago.
6 years ago. Was it painful?
No.
Not really, or?
Not really.
Comfortable.
It's not comfortable, but it's comfortable enough if you want the hair.
Right. It's worth a little bit of pain. Dr. Cohen, what is the process?
Well, the process basically is based on the fact that in a bald man, you can always have a rim of hair that's left, and that's what we call the donor hair. And if you move that hair to the front, to the bald area, that hair will continue to grow forever.
So you're taking live hair.
It's genetically predetermined to grow.
That's amazing.
That's why it works.
You would think the follicles were dead. Not so?
Well, the follicles in the bald areas are dead, but when you move these follicles from the back and put them into the bald area, they continue to grow just as they did in the back of the head.
That is amazing.
That was the original studies that were done on hair transplantation, and the original work was done in the 50s, and the patients still have their hair.
That
hair is going to grow forever.
It will grow, they'll need haircuts.
Yeah, that's his own hair. It's just moved to a different place.
That is amazing. Let's show folks what what we call plugs. I'm sure that's not what you refer to them as. Now, this is what the old hair transplants looked like.
Those are the old doll's head transplants. Now, they worked, they just didn't look very good, so you could never show anyone your hairline. And that's the difference between the old transplants and today's transplants.
And here's the new one, which is, you would never know that was transplanted
patient,
hair.
That's all single hairs placed in the front of the scalp.
If somebody had the old transplants, the old plug-looking transplants, can they have it redone at this point?
Absolutely. As a matter of fact, 25 years ago, I was doing the old transplant, so my patients still have their hair. They would just like to expose their hairlines now. So we can just go right in front of those old plugs and
you can do
put the new single grafts, and it looks terrific.
How much does this cost?
Anywhere from $3,000 to $5,000 per session, and you may need 2 sessions.
And when you...
Some people need more, but that's
when you do the actual procedure, is there cutting involved? I mean, cutting into the scalp?
Well, part of the scalp is removed in the back, a small, narrow piece, and that supplies the hair. And then that piece is taken, separated under microscope into hundreds and hundreds of little single hairs, and it's planted into the front.
Okay, so it is surgery. I mean,
Surgery, it's done under local anesthesia.
Okay.
I mean, most of the time, patient is lying on his back watching TV.
When can they get back to work afterwards?
They could go back the next day. Some people take some time off, but...
Wow, not a big recovery. Were you able to get back to your salon?
Next morning.
Get out. That is unbelievable. And you felt okay?
Yeah.
And what did people say when they saw you with more hair than they'd seen you with in years?
Well, before I just have a little hair on the side and cover it up.
Yeah.
So they didn't see I was doing that.
So they didn't really
People
know
never
just
knew
how
unless
bare
I
it
tell
was.
them.
And with being a hairdresser, you knew all the tricks.
Right.
I appreciate that. I want to touch on the fact that women also can have this done. Here's an example of a woman who came to you, and this is the before picture. What was her case?
Right. Now, she has hair loss, which is similar to the way a man loses his hair. You can see she had thick hair around the side, so we could take hair to do the transplant. This is after one procedure, and she looks great. And many women are now finding out with this new technique that it looks very natural.
Unbelievable.
Before, women were not interested. Now they are.
One last question. If a woman's hair is thinning, can she have a few pieces put in to thicken it up?
Sure, yeah.
That's great, because I know a lot of women, after they have babies, that happens. Thank you both so much for being here. We had Dr. Ivan Cohen, who's based in Fairfield, and, of course, Mr. Joseph, who has his own salon in Westport. And that wraps up our medical news for now. Thanks for watching 12 on Health, and have a healthy weekend.